Let me tell you something many people quietly carry inside for years, but don't always say openly. A person may feel healthy, look healthy, work normally, exercise, eat reasonably well, and still carry one thought in the back of the mind. And this thought is, my father had a heart attack. My mother had a bypass surgery. My uncle died young. Does that mean the same thing is waiting for me? This fear is very, very common because family history creates uncertainty. A person starts wondering, is my future already decided? Are my arteries already following the same path? Can I really do anything if genetics can I change and do anything if genetics are strong? And the answer is very important. Family history matters greatly, but family history is not destiny. Genes increase risk, but genes don't control every decision you make. And modern prevention can change a great deal. To understand what to do, we first need to understand what family history really means biologically. So why family history matters so much? When coronary artery disease appears early in a family, it often means biology is inherited. And that inherited biology may include how LDL behaves, how inflammation behaves, how blood vessels age, how clotting behaves, and how lipoproteins circulate. That means two people can live similar lives but carry different internal risk because genetics are different. That's why family history gives us an early information before symptoms appear. It tells us you may need earlier attention than someone without that background. And this matters especially when disease happened early in relatives, because timing changes how seriously we interpret risk. Now, what counts as strong family history? Not every family history carries the same weight. The strongest concern is early disease. For example, father with a heart attack before the age of 55, a mother with a heart attack before the age of 65, sibling with early coronary disease, multiple close relatives affected. The earlier it happened, the stronger the signal, because early disease often means stronger inherited risk and inherited biology. And if several family members are affected, suspicion becomes even stronger. This doesn't mean disease is guaranteed. It means prevention should begin earlier and more intelligently. Okay, why you may look healthy from the outside and still carry risk? Well, many people with strong family history look completely healthy. They are not obese, they function well, they exercise, they sleep well, they have no symptoms whatsoever. But still, silent plaque may begin earlier than expected, because inherited LDL exposure often starts young and arteries respond to lifetime exposure. That's why looking healthy never replaces measuring biology. Well, mentioning biology, what are the first step? Is knowing your numbers early. If family history is strong, numbers matter early, not later. And these important tests are LDL cholesterol, HDL, triglyceride, non-HDL cholesterol, ApoB, and lipoprotein (a), because sometimes standard cholesterol misses deeper inherited risk, especially ApoB and lipoprotein (a). And these numbers often explain why family history and family disease happened early. So why lipoprotein little a matters more in family history? Well, lipoprotein little a is one of the most important hidden inherited risk. Many people never check it. It's not part of the general cholesterol tests. But in strong family history, it becomes critical because lipoprotein little a is strongly genetic. A person can eat perfectly, exercise daily, stay thin, but still carry dangerous elevation. That's why every person with strong family history should know this number at least once in lifetime, because one abnormal result changes prevention intensity for life. What about the ApoB? ApoB tells particle burden. Sometimes LDL looks acceptable, but ApoB remains elevated. That means particle number is still high, and arteries respond to particle burden over time, which is why ApoB often reveals silent risk missed by basic LDL alone. What about calcium score? Well, calcium score changes everything. One of the strongest tools in a healthy people with strong family history is calcium scoring, because calcium score directly asks, has silent plaque already begun? A person may feel perfect, but calcium already appears. And once calcium appears, that means prevention becomes much more urgently. You have to work on it right away. Let's say that you did calcium score and your calcium score is 0. Well, 0 calcium score is reassuring, but, and there is a big but here, not complete protection. Because soft plaque may still exist before calcification appears, especially for younger people. That's why calcium score helps, but must be interpreted in context. What about LDL, or the bad cholesterol? Should be taken more seriously in family history? Well, an LDL that looks borderline in general population may deserve more attention when family history exists, because inherited biology lowers tolerance for prolonged exposure. An LDL of 140 may carry different meaning in someone whose father had an early heart attack. That's why context matters more than one isolated number. What about food? Food matters even more when genes are strong. Genes load a gun. Lifestyle influences whether the trigger gets pulled. So food becomes powerful. And here's what you can do. Reduce saturated fatty acids. Increase fiber. Avoid frequent processed food. Lower liquid sugar. Increase vegetables. And use olive oil more often, because every small change and reduction in LDL matters more when inherited risk exists. What about exercise? Exercise is protection, not permission. Exercise helps enormously, but exercise doesn't erase inherited biology. Exercise can lower inflammation, improves insulin sensitivity, supports blood pressure, but still must work alongside numbers. What about weight? Weight still matters even if you look fine. Even modest visceral fat increases risk, and visceral fat often exists even in people who don't look like obese. That's why waist circumference matters too. What about blood pressure? Blood pressure control is very important. You must be strict with it. In strong family history, pressure should not be ignored. Even mild elevation accelerate inherited risk. What about sleep? Sleep is very important and matters more than people think. Poor sleep worsens pressure, inflammation, and insulin resistance. And inherited risk, every extra stressor matters. Talking about stressors, what about life stressors? Well, stress doesn't create genes, but stress amplifies gene expression biologically. And chronic exposure to stress creates chronic exposure to cortisol, which increases vascular strain. Okay, so should healthy people with family history take statin early? Sometimes yes, especially if LDL elevated, ApoB elevated, Lp(a) elevated, and calcium score positive. This is not weakness, this is prevention. And prevention is very important. So why waiting for symptoms is wrong? By the time symptoms appear, plaque may already be advanced. And that's why prevention must happen before symptoms. Now, let's talk about your future, especially for someone with strong inherited family history. If your family history exists, know your numbers regularly. Track trends, repeat labs, consider imaging when appropriate, and stay consistent, not extreme. The whole point of this video is I don't want you to feel afraid. I don't want you to feel obsessed with all this information. It doesn't mean your future is already written. It means awareness, and awareness is prevention. And here's my final message for you. If your family has strong coronary artery disease history, especially early, don't panic. Don't ignore it either. Use it as information, because family history gives you something powerful. You know what's something powerful? Is the chance to act before disease speaks. Your relatives gave you a warning. Modern medicine gives you options. Use them. And prevention done early can completely change the story. If this helped you understand the inherited heart risk better, please subscribe. Thank you for trusting Dr. Noni's Power Lab. Have a great day. See you later. Bye-bye.